incredible superstar panel today. I work with Amnesty International, where I'm doing research on the human rights impact of criminalizing key aspects of sexuality and reproduction around the world. The primary goal of this project is to foster intersectional discussion across sectors and disciplines and advocacy around these issues, and that's why I find this conference today so exciting. It's bringing together advocates and experts from so many different areas. So moving from the previous presentation on the specific law here in Tennessee, I'm going to take a bit of a step back to approach the issue from the perspective of international human rights law and principles, and look at where this fits into that larger context, and I hope I can bring some of that perspective to this discussion. Human rights are basic rights and freedoms that all people are entitled to. These rights and entitlements are grounded in both international legal instruments, such as human rights treaties, and national constitutions and laws. In many ways, the law in Tennessee reflects broader trends. Around the world, states are increasingly relying on criminal laws to punish sexual and reproductive actions and decisions. And public health and safety are often used as justifications to restrict individuals' rights related to their bodies, their health, sexualities, and reproduction. And as we've seen so far in Tennessee, these restrictions are more often enforced and imposed upon those with fewer resources and in more marginalized positions in society. Many factors around the world prevent pregnant people from enjoying their human rights, including discrimination, violence, stigma, and other barriers to accessing health care. And along these lines, drug control policies, attacks on sexual and reproductive health and rights, and discrimination in the health care system can have a disparate impact on women. And as I think we'll be hearing later today, that across the United States, a whole variety of laws and other policies are being used in novel ways to punish women for their behaviors during pregnancy. But all of that being said, despite all of these issues, it's important to note that criminal laws that are explicitly directed at pregnant women are actually quite rare, and the current policies in the United States and the law in Tennessee in particular are outliers in this regard. In fact, outside of the US, very few countries at all have punitive policies addressing substance use during pregnancy. And in the very few cases that do, the issue is addressed in a health code, not in a criminal law, and used quite sparingly. So what human rights are implicated in this kind of a law? Laws that criminalize women for their actions during pregnancy raise a number of human rights concerns. The threat of criminal liability places pregnant women in a situation where they may be exposed to arrest or prosecution as a result of seeking healthcare services. This can infringe upon pregnant women's rights to health, equality and non-discrimination, and privacy, among other rights, which are more difficult, sort of happen in fewer cases, but those are very frequently seen. Despite the purported health-related aims of laws penalizing pregnant women's behaviors, professional health associations and human rights experts have uniformly dismissed such legislation as damaging to public health and human rights. The UN's Special Rapporteur on the Right to Health, that's an international expert appointed to advise on these matters, has studied this issue and concluded that criminalization of conduct during pregnancy impedes access to healthcare services. Now, the right to health does not mean the right to be healthy. We know all too well that good health is not something that can be ensured by a government, ever. But it does impose on governments an obligation to create the conditions in which everyone can be as healthy as possible. And timely and appropriate health care, including substance abuse and reproductive health care services, are part of this. There are also a number of structural barriers that make it difficult for pregnant women in particular to access health care. At the structural level, the most significant obstacles include punitive attitudes to parenting and pregnant women, which make women fear losing custody of their children and prevents them from seeking treatment. Often women do not have money to pay for childcare or transportation, and treatment programs may be located far away from where they live. And in some jurisdictions, child welfare authorities may equate substance use problems with abuse or neglect. And an unintended consequence of that policy is that women who have substance use problems may be less likely to seek prenatal care. As others will discuss in greater detail today, the current health system in Tennessee is simply not equipped to provide treatment for all of the people who need it, and especially the pregnant women who need it. So on top of all of these challenges that women face, adding in a criminal law that imposes penalties is just one more barrier to accessing care. Based on our research and our interviews in Tennessee, we've found that many of these dynamics that have been identified globally are playing out in this local context as well. For example, one woman we spoke to at a treatment center confirmed this chilling effect that criminal law can have on access to services. When reflecting on why some pregnant women hesitate to seek treatment when struggling with addiction, she worried, am I going to get in trouble? Are they going to call the Department of Children's Services? I want to get good health care, but I'm scared, to be honest. Another woman we spoke to told us that even after she went into labor, she was unsure of what to do and had her partner looking up ways they could give birth at home or go to another state. And even after having gone to the hospital, she was unsure if this was a wise choice because of the dangers of getting caught. In some of our interviews with healthcare providers confirm these views as well, saying patients are showing up later in their pregnancies for prenatal care or even disappearing from the hospital after hearing that they were going to be reported. The stigma surrounding drug use is intense, and especially for women struggling with addiction while trying to achieve a healthy pregnancy. However, a human rights approach requires seeking out and listening to these voices most impacted by laws and policies. So if the goal is to improve the health of mothers and newborns in Tennessee, as legislators have claimed, then there are other policy responses aside from expanding the scope of the criminal law. In fact, while states generally do have latitude to determine what types of conduct are significantly harmful to merit criminal punishment, this policing power is not unlimited. Various human rights principles impose limits on state actions that infringe on individuals' human rights. First, as criminal punishment is one of the most severe forms of state intrusion on civil liberties, it must be used as a last resort. In other words, if there are other less intrusive means to achieve a state goal, then those should be pursued first. And beyond this, criminal justice endeavors which implicate human rights may be confined by the principles of legality, legitimate purpose, necessity, proportionality, reasonableness, and non-discrimination. Governments must also demonstrate that they have a legitimate purpose for restricting individuals' human rights. Notably, state aims to ensure healthy pregnancies and deliveries can likely be more effectively achieved through other means. In applying these principles, we can ask, is the law reasonable, or does it cause more harm than good? Is the law applied equally to all people? While acknowledging that we're talking about human rights which apply to everyone, there are particular human rights instruments that apply specifically to discrimination against women. And additionally, principles of equality and non-discrimination underlie all international human rights instruments and serve as an overarching obligation for governments. The right to equal protection under the law, which is a component of the right to equality, is particularly relevant here, given the fact that the wording of the law defines this as a form of assault as a crime that can only be committed by a woman. Criminal and other legal restrictions on women for their behavior in pregnancy create a form of liability unique to those who become pregnant. And in addition to this discrimination against women, which is explicitly written into the law, the way the law is applied opens up the possibility for uneven application, discretion, and discrimination. We know from major studies, such as the most significant one completed by National Advocates for Pregnant Women, and Lynn Pelcher, who's here, that laws criminalizing pregnant women's conduct are likely to disproportionately impact the most marginalized women, including rural women, poor women, minority women, and those with limited access to health care, to drug treatment, and the services they need to bear healthy pregnancies. So while laws criminalizing pregnant women's conduct technically apply to all, those from minority groups and underserved areas have been historically disproportionately targeted and prosecuted as a result of these laws. And I think as we were discussing, the data that is coming in is confirming a lot of these historical trends are continuing. So referring back to the Tennessee District Attorney's survey that Tom Castelli mentioned, and investigative news reports, and also cases tracked by public defenders, we can tell that there's wide variation in the number of prosecutions between counties, and also variation in how the law is being applied. There are also variations in hospital testing practices, and discretion among doctors and nurses to test some patients for drug use while not testing others. Disparities in the criminal justice system and disparities in maternal health are also overarching factors. The Committee on the Elimination of Racial Discrimination has observed that women from racial and ethnic minority groups in the United States, especially those who are low income, disproportionately lack access to prenatal care that is essential for healthy birth outcomes. And these disparities have been also documented extensively by Amnesty International. So in conclusion, while states and society more broadly have an interest in ensuring safe pregnancies, this interest cannot subsume the interests in human rights of pregnant women. There are more effective rights-respecting ways of ensuring safe pregnancies and deliveries that may not infringe on human rights. In order to promote health and reduce harm, we must address obstacles that currently impede women, in particular women living in poverty or from marginalized groups, from having access to quality health care on an equitable and non-discriminatory basis. Human rights norms and principles require states to place particular emphasis on at-risk groups, such as those struggling with addiction. In many ways, the state is failing at this obligation. But this conference today indicates there is great interest in considering the impact of these policies, the impact that they have on civil and human rights, and also energy to advocate for change. And that's why